Logan White.
Malcolm Myers.
Kyle Moyer.
Anna Salto.
Natalie Dykes.
In 2020, over 50 million Americans have struggled with a mental disorder, according to Madeline Rayner, Senior Director of Population Health at Mental Health America, stated in the journal State of Mental Health in America, published October 2021.
Everyone in this room has an understanding that people's mental health status cannot always be recognized.
A variety of mental health illnesses affect people on a daily basis with different levels of severity.
First, we will discuss schizophrenia, then dissociative identity disorder, and then OCD.
Fourth, we will discuss bipolar disorder, and finally, post-traumatic stress disorder. There are many different types of effects that these disorders have on the people being absorbed by them. Schizophrenia can be perceived in many different ways. Dr. Martha Branch, a graduate of the University of Monterey and a psychiatric specialist, stated in the Journal of Psychiatric Treatment Network, published April of 2022, that schizophrenia is often a misunderstood mental health disorder. It is a chronic and neurological brain disorder that was discovered in 1887 by Dr. Emily Kraepelin, and unfortunately, the cause is unknown. Dr. Merle Williamson, who is a graduate of the Oregon Health and Science University School of Medicine and medical director at Crestview Recovery, stated in the Journal of Crestview Recovery, updated on January of 2022, that the prefrontal and medial temporal lobe regions of the brain are affected when an episode occurs, which are correlated with working memory. There are many different effects when an episode happens. Dr. Edwin Torrey, who is a graduate of McGill's Faculty of Medicine and Research Psychiatric, stated in the Journal of Treatment Advocacy Center, published in January of 2022, that males have a 5.1% earlier death rate and females have a 5.6% earlier death rate after diagnosis. Felix Torres, a graduate of Yale University and Chief of Forensic Medicine at Texas Health and Human Services State Hospital, stated in the Journal of American Psychiatric Association, published in August of 2022, that when an episode occurs, these people cannot distinguish between real and unreal experiences, often described. Although schizophrenia is not common, we do hear about it quite often. It affects only 1.1% of the general U.S. population. Although there is no cure, there are many different psychological treatments, such as behavioral therapy, that have shown to reduce symptoms and enhance function. Now that I've talked about schizophrenia, Anna is going to be talking to you about dissociative identity disorder.
Dissociative identity disorder makes a person showcase different self states. Only 1% of the population struggles with dissociative identity disorder. From Dr. Catherine Rubin, who studied psychology at Georgia University and has 12 publications in dissociative identity research, last updated in November of 2022. Dissociative identity disorder is more commonly known as multiple personality disorder. Dissociative identity disorder, as a name, gives more insight into what the disease truly is to someone who's affected by it. The first case of dissociative identity disorder was by Jeanne Ferry in 1584. She was known to have insane hysteria attacks, and a group of priests gathered together to do an exorcism on her. It did not work, and she was seen as a form of evil to her society. Symptoms of dissociative identity disorder is amnesia that complicates your brain from realizing what is the real world and what is not. From Dr. Jeffrey Detzel, who is a general psychiatrist in New York and studied at Des Moines University. He was awarded Army Commendation Medal for Division Psychiatrist in Iraq, published on Psych Central in May of 2021. So, dissociative identity disorder is caused by severe trauma in one's childhood. This creates a second identity in the person's life to help them cope with their trauma. From Dr. Daniel Hall-Flavin, psychology editor at Mayo Clinic, reported on Mayo Clinic's dissociative disorders, last updated in November of 2022, or 2021. brain activity during this is not realizing what is the difference between real life and what is going on in your brain. It can lead to having different alters, also known as your multiple personalities. This leads to having basically multiple people in your brain, and they can have different histories, ethnic backgrounds, races, genders, and key characteristics. Treatment for dissociative identity disorder is therapy. Although medications do help, therapy is shown to be the best form of help because it can help merge together your alters and help with what led to dissociative identity disorder. So now that I've discussed dissociative identity disorder, Kyle will explain obsessive compulsive disorder.
Obsessive compulsive disorder is something that many people struggle with on a daily basis. OCD is a unique mental health illness. Dennis Murphy, who is a doctor of medicine, in the journal Dialogues in Clinical Neuroscience, published in 2020, says that OCD is an anxiety disorder that causes unreasonable thoughts and actions, which society recognizes as being unreasonable. The criteria to diagnose OCD as a mental health disorder was first published in the 1980s. John Grant, who is the professor of psychiatry and behavioral neuroscience, along with Samuel Chamberlain, who is the professor of psychiatry in the Department of Psychiatry at the University of Southampton, in the journal titled Exploring the Neurobiology of OCD, published in 2020, says that OCD can affect multiple parts of the brain depending on how the diagnosis is categorized. While the cause of OCD is usually genetic, it can be shown that the rate of OCD is higher in people who have experienced physical head trauma. The symptoms of OCD affect people on a daily basis. Jonathan Abramowitz, who has a PhD in clinical psychology, along with Lillian Ruman, who has a doctorate in clinical psychology, in the journal Obsessive Compulsive Disorder, published in 2020, says that there are a wide array of symptoms of OCD, which include intrusive thoughts and actions about cleanliness or contamination, organization or symmetry, the feeling of needing to be in control, the feeling of being responsible for harm done to others, the feeling of being responsible for mistakes, as well as the feeling of sexual desires. These symptoms affect all people differently and might not show up in every case of OCD. OCD cases are seen around the world throughout many different cultures, and they all share some common features, like the symptoms. 2.3% of people in America have these symptoms of OCD, and since these symptoms can also overlap with other mental health illnesses, it makes it difficult to diagnose OCD. The best treatment for OCD is exposure and response prevention therapy, in which people are exposed to their obsession to acclimate them to it. Although this is very hard for people with OCD to continue, so many quit or even stop treatment before it starts. The mental health of other diseases can be present at the same time as OCD, which makes it complicated to continue the treatment. If people don't get treatment they need for OCD, they can experience symptoms for their entire life. Now that I have discussed obsessive compulsive disorder, Malcolm will discuss bipolar disorder.
Bipolar disorder is a chronic mental illness. However, bipolar disorder actually encompasses two similar yet different disorders, according to Dr. Roger S. McIntyre, a professor of psychiatry and pharmacology at the University of Toronto and head of mood disorders in the journal The Lancet, published in 2020, stated that bipolar I disorder consists of syndromal manic episodes, and mania. The symptoms of mania tend to be restlessness and irritability, along with other things, while bipolar II results in hypomanic episodes that last for 2 to 4 days, along with cycles of depression. Bipolar I disorder is closely linked, or genetically linked, to schizophrenia, while bipolar II is closer genetically to depression. The prevalence of bipolar disorder is dependent on the type, with bipolar 1 disorder having a prevalence of between 1 and 0.6%, while bipolar 2 has a prevalence of 0.4 through 1%. These surveys were conducted primarily in higher economic countries, so the estimates are said to be higher in countries that have a lower economic standing. The treatment for bipolar disorder is a complex topic, considering that 60 to 80% of patients will relapse after treatment from their first manic episodes, and it tends to result in therapy anywhere from 6 months to years, if not therapy for the rest of your life. Now that I've talked about bipolar disorder, Logan will talk about post-traumatic stress disorder.
PTSD, which is an abbreviation for post-traumatic stress disorder, according to Douglas Bramer, who is a doctor of medicine in the Journal of Dialogues in Clinical Neuroscience, published April 2022. PTSD is a chronic mental disorder that happens when someone witnesses a traumatic event that happens in their life. And an episode of PTSD is when they relive the traumatic event that they had witnessed. And most common triggers for the events in their life, or for the PTSD episode, is common reminders of the event. According to Laura Watkins, who has a PhD in behavioral science in the journal Frontiers in Behavioral Neuroscience, published October 2018, there are multiple causes that could give someone PTSD, cause a traumatic event. It could be from getting assaulted to getting raped, or the most common place is soldiers getting it from combat, but it can also come from something as simple as a loved one passing away and that being traumatizing to you. It affects the hippocampus, amygdala, and the prefrontal cortex of the brain, which has to do with memory and processing threatening stimuli. According to Bessel van der Kolk, who is a doctor of medicine in the Journal of Dialogues in Clinical Neuroscience, published April 2022, the first really known cases was around World War I, World War II, and it was they're referred to as hysterical patients, and it was a group of World War I vets during World War II, and then there was a pretty big outbreak during the Vietnam era as well. The symptoms include depression, outbursts, and self-destructive habits, and if someone was mistreated as a child, they have a 4 to 12 times higher likelihood of starting this self-destructive habits. PTSD will affect about 8% of all Americans in their lifetime, and about 10 to 20% of people that witness a traumatic event will have PTSD symptoms caused by that. Women have 2 times the risk of getting PTSD from witnessing a traumatic event than men do. But there have been medical breakthroughs, which include therapy and medications such as antidepressants, and there are several types of therapy. Unfortunately, the dropout rate is about 18% of everyone that tries getting help. The early treatment, which was, when it was first invented, was actually said to be worse than not doing anything at all. So medical treatment has come a long ways from where it first started.
First, we discussed schizophrenia, and secondly, we discussed dissociative identity disorder, and thirdly, we discussed obsessive compulsive disorder.
Fourth, we discussed bipolar disorder. And fifth, finally, we discussed post-traumatic stress disorder.
There is a large variety of mental illnesses that affect people daily with different levels of sobriety.
People struggle with different mental health disorders daily.
Let's be more vigilant of the 50 million Americans that struggle every year.